An ectopic pregnancy is an abnormal pregnancy that occurs outside of the mother's womb. This is commonly referred to as tubal pregnancy. Now let's take a look at the woman's anatomy. The fallopian tube is the most common site for an ectopic pregnancy. Let's first watch how a sperm fertilizes an egg and how a normal pregnancy occurs. Here we look at the site of a normal pregnancy. The embryo has traveled through the fallopian tube and into the uterus. So still, what exactly is an ectopic pregnancy? Let's go ahead and observe what happens. Here we see the growing fetus growing within the fallopian tube. Both woman and growing fetus are affected by this type of pregnancy. The most common complication is rupture within and internal bleeding that leads to shock. Ectopic pregnancies cannot continue to birth. The developing cells must be removed to save the mother's life. You will need emergency medical help if the area of the ectopic pregnancy breaks open or ruptures. A laparoscopy is the most common surgical treatment for this type of pregnancy for a fetus that has not ruptured. If there is a rupture, surgery is done to stop blood loss. This surgery also is done to confirm the type of pregnancy, remove abnormal pregnancy, and repair any tissue damage. This is usually caused by a condition that blocks or slows the movement of the fertilized egg through the fallopian tube. Up to 50% of women who have an ectopic pregnancy have had swelling or inflammation of the fallopian tubes or pelvic inflammatory disease. Taking hormones, especially ones like estrogen and progesterone, such as those found in birth control pills, can slow the normal movement of the fertilized egg through the tubes and lead to an ectopic pregnancy. The symptoms of an ectopic pregnancy is very similar to those of a normal fertilization. Shock is the first symptom of almost 20% of ectopic pregnancies. This situation occurs between 1 in every 40 to 1 in every 100. This is a fairly common occurrence. But there's still hope. There are many occurrences where women had still had normal pregnancies after that of an ectopic one.